Our healthcare system sucks. It's not only in shambles, but it's built on a for-profit motive rather than one that's set to make quality care accessible to the most amount of people. That matched with its intertwined nature with being required to work to have it, you can see where problems begin to arise. Despite America by far spending the most on healthcare, 18% of our GDP, we rank below 30 countries in things such as preventable deaths, infant survival, maternal mortality, and overall life expectancy, with even poor countries like Cuba beating us in most of these metrics solely due to having a universal healthcare system. I mean, our life expectancy is below the global average, and we're the only developed country to not guarantee healthcare to all of its citizens. Per capita, we have the highest infant and maternal mortality during childbirth of any country. And remember, wealthiest country in the world. We have the citizens most likely to have chronic illness, all while having one of the lowest rates of physician visits and practicing physicians. Don't get me started on obesity rates. And when we look at other metrics like the countries beating us, they all have a form of universal healthcare in place. If we look at the rankings in the Commonwealth Fund, all the top countries have universal healthcare, with the bottom 3 countries being us, Canada, and Switzerland. Switzerland's healthcare is very expensive and you pay out of pocket to receive it and then later are reimbursed down the line in like a form of taxes. So the burden of paying out of pocket still remains in their system. Canada has a unique problem where in being close to America, doctors can get their degree and their license to practice for cheaper in Canada with their free education and their healthcare system, and then come to America to make more off of our for-profit healthcare system, effectively seeing America poach Canadian doctors and increasing their wait times. So the bottom 3 countries all have problems centered around or tied to a for-profit motive. Studies support a switch to single-payer healthcare not only saving $458 billion, or 13% of our GDP expenditure, but it would also save almost 70,000 additional lives per year compared to the Affordable Care Act. Or if we go to the time before the Affordable Care Act, an additional 107,000 lives a year from what would be private healthcare, a private multi-payer healthcare system. You would see multiple reduced fees in hospital and clinical services, seeing around 5 to 7% in additional savings without coming out to about $100 billion annually being saved. If we look at countries like Spain, for instance, the cost of giving birth in Spain is over $2,000. It's around $2,333, I believe, compared to America, where it's over $14,000 to give birth. But the neonatal mortality is double in America what it is in Spain. So we're paying 6 times the amount with double the mortality. A majority of the bulk and savings would also be seen in administrative costs, as America already spends 8 times more than any single-payer healthcare system or country with that system in place does. This would reduce the currently $768 billion overhead that our taxpayers are paying by almost $300 billion. While also eliminating unpaid bills and massively reducing paperwork for physicians, which is reported as the #1 cause of physician burnout in the US, the country with one of the lowest rates of practicing physicians. Solving multiple problems here. Single-payer healthcare is the most efficient form of healthcare available to the world, and it's about time that the wealthiest country in the world catches up with the rest of the developed nations and guaranteeing its citizens affordable and quality healthcare, rather than strangleholding them to break their bank to pay for the healthcare, and lots of times scaring them from ever accessing that care and making them have to work to have any bit of comfort from that. If you enjoyed this video, we're Social Society. We're a commentary channel influenced by politics, society, and the economy. We are pretty left-leaning on this channel, but we're open to our right-wingers as well. The biggest thing here is having conversations that get everyone to the bottom of the truth. If that sounds like something that could interest you, consider smashing that subscribe button, leaving us a like, or even commenting on this video, because the only way we become a society is together.